All right, so welcome to Introduction to History Taking and Communication. You need to pay real attention to why history taking is really important. You must get the basics right so that when we get to history taking proper, you pay attention to the various components, right? So the target audience for this video include medical students. Whether you are being trained here in Ghana or you are training abroad, you find this video really useful. I think those who are training abroad may have to watch this video over and over again so they can understand exactly what the system requires of them when they return back home. Physician assistants, students, and practitioners will find this video also really useful. Nurse practitioners in training or practicing will find the video useful. Specialist nurses and midwives who are also under training. Tutors of healthcare sciences, the various training schools, and any other healthcare professional interested in learning how to take history will find this video really useful. Now, in medicine, the approach to patient, or have you ever wondered how doctors make diagnoses? You know, a lot of patients think that to make diagnosis, the doctor must do an investigation, request for a lab test, or do an imaging study to establish what is wrong with me. And many a times you hear patients complain that I have been to the hospital and the doctor did not send me to the lab or didn't send me to do any images and said I have this condition, I don't trust him, and then they go to another hospital and they keep roaming from one hospital to another. Because to them, the best way for a doctor to make a diagnosis is to do an investigation. By the end of this presentation, you understand exactly how diagnosis is made and why investigation is not the main way by which doctors make diagnosis. And I'm sure that you can share this with your friends and family if you ever had any of them complaining about not being sent to the lab to do any investigation. Now, I'm going to take you through a step-by-step approach as to how clinical diagnoses are made by doctors. The first and most important thing is taking detailed history. History taking is simply the doctor listening to what is wrong with you and asking you relevant questions to elicit exactly the problem that brought you to him. Okay, so for a doctor to make a diagnosis, the doctor must take a history. And history taking is perhaps the most important tool that the doctor has in making a diagnosis. So detailed history taking, then from there the doctor must do a physical examination. Okay, physical examination has its role in making a diagnosis. Physical examination contribution to diagnosis, it's very small, and I'm going to give you the percentages with evidence and data that is already published if you have any doubt, right? Then from there, the doctor must conduct an appropriate investigation and then give a treatment. So if a patient comes to the hospital, the doctor is likely to slide through all these 4 important steps to be able to treat the patient. The first and most important step is to take a detailed history. Then the doctor will conduct a physical examination and, if necessary, would conduct an appropriate investigation. And then once the diagnosis is certain, then a treatment is given. This is the standard approach to patients. And this is what is practiced all over the world by doctors. And out of these 4 steps, I'm going to focus more on history taking because, like I said, about 80% of time, for you to know what is wrong with the patient, you know that through history. Not through physical examination, not through investigation. It is through history taking. So history taking is so important that as a medical student, you cannot joke with it. And because it's really important, at every clinical exam, they will test you on it. So you have to pay attention and understand the basics of history taking. Again, there is a term called clinical examination. If you read TC Ankara, they use the term clinical examination. When we say you have to conduct a clinical examination on a patient, what does that mean? It means that you must take a history, you must conduct a physical examination, and if possible, do a bedside or a side room investigation, and then you can establish the clinical diagnosis for the patient. So you must understand this term. Now, medical history taking, what is it? History taking is a science. The science aspect is exactly what we are going to learn from here. Try to tell you the nitty-gritties, the details you have to know. But you must also acknowledge that history taking is not just science, but it's also an art. And you know, for you to perfect an art, you must repeatedly do that art. Is that not it? Exactly. So history taking is just not a science, but it's also an art. And history taking forms the basis upon which diagnoses are made. And I think I've mentioned this earlier. Perhaps the most important tools that a doctor has, or the most important weapon the doctor has, is history taking. At the end of a good history taking from TC Ankara, 60 to 70% of times the doctor can actually figure out what is wrong with you. If the doctor is unable to figure out what is wrong with you at the end of history taking, at least the doctor will have an idea which part of or which system of your body is affected by the problems you have. So you see how powerful history taking is, and that is why you cannot take it for granted if you find yourself in medical school. Without history taking, your doctor is totally blind and may not be able to tell you what is wrong with you. If you meet a doctor and a doctor doesn't take a history from you and tells you that there's something wrong with you, you may have to, think twice about it, because history is the eye of the doctor. A good doctor is therefore also a good history taker. So if you want to be a good doctor, you must endeavor to be a good history taker. Now, why is it important? Why is history taking even important? Like I indicated, it helps you to make a diagnosis. And the evidence are this. In the British Medical Journal in 1975, I'm sure you say, hey, 1975 is several years back. But nothing has changed, eh? Okay. There was a publication by Hampton et al. And they did a study and concluded that 80% of correct diagnoses were made from history alone. They did a study across various hospitals. If you get a study, you can read about it and present patient to doctors, and doctors take history and they ask what is wrong. And 80% of time, after the doctor has finished taking a clinical history from the patient, they already know what is wrong. And the diagnosis they give is correct. And from that study, only physical examination only contributed 10% to making the correct diagnosis. Again, investigations contributed 10% to making the diagnosis. So it means that the doctors were wrong only 20% of time without doing physical examination or investigation. But 80% of time, once they finish with the history, they are able to tell what is wrong with you. The second evidence is this. Another study was done in 1992, and it was published in the Archives of Internal Medicine by Peterson et al. And they concluded from that study that 76% of correct diagnoses came from clinical history alone. Physical examination only contributed 12%, and lab tests contributed 11%. The last evidence I would like to present to you is a study by Epstein et al. In 2003. And this study was also published in the Journal of General Internal Medicine. They also concluded from that study that 80% of diagnoses in general medical clinics are based on interview alone. So, ladies and gentlemen, you see how powerful history taking can be. And like I indicated earlier, if you want to be a good doctor, you want to be a good physician assistant or nurse practitioner, the important thing you should focus on mastering it is history taking. So we always say that if you see a doctor who is overly reliant on tests, like requesting investigations, just to establish what is wrong with the patient, then it reflects that that doctor has weak clinical reasoning, and it is not a good practice. What it means is that the doctor is likely to request for a lot of investigation, which will be extremely costly to the patient and also to the healthcare system, and of course can lead to shortages, so that the real patient who need to do the test, when they are ready to go do the test, consumables are already finished because another doctor has requested people who don't need this test to go do it. So it's very important that doctors, practice and master the art of history taking. Beyond making diagnosis, history taking is also important to determine the severity of symptoms of the patient. It is important to establish if the patient has already developed complications. It's important in the treatment and monitoring of the condition of the patient. History taking is that important. And also, history taking also serves as a medical legal record, so that if, for instance, you've seen a patient, for instance, there's a case of rape or whatever, and it goes to court, your history taking is, your records of history can be a very reliable record that can be used in court, And beyond all this, it is also a source of information for research, a source of information for reportable diseases, and also for insurance claim. So it's very important that history taking is not taken for granted. And to quote one of my professors in UDS, he will always say, "Take it from me. If all you do in the medical school is to master the art of history taking, then you're already a good doctor." Please note that. Therefore, don't take this for granted. Now, if you are a foreign trained doctor, you must know what exactly is expected of you before you go take history. If not, you're going to disgrace yourself. History taking in the setting of Ghana, West Africa, Nigeria has a similar system, right? It's really, really detailed. It's rigorous. It is laborious. And the system wants the history taking to be done in a specific way, which is slightly different from what is done elsewhere. And you must be able to acclimatize yourself to the system here in Ghana. So if you are foreign trained, please try to apprise yourself with this. You can start this even before you arrive in Ghana, so that it becomes much more easier for you. What are the approaches to taking history? The approaches vary. The approaches you use, that are used in history taking, depends on the location you are, where you train, okay, or the jurisdiction you find yourself. Your approach will be slightly different. It also depends on the age of the patient you are dealing with. It's slightly different. The physiological status of the patient. For instance, history taking in pregnant women, the approach is slightly different from maybe a normal adult. Age, the approach in pediatric is slightly different. Okay, so the approach varies depending on your location and also the age of the patient, the physiological status of that patient, and even the specialty that you are in. For instance, the history taken in general surgery, for instance, is slightly different from what is taken in pediatrics, So you must know the variation that exists. But irrespective of which of these variations that applies to you, at the end of your history taking, you must be able to establish the cause of the patient problem, or at least you must have an idea about what is wrong with the patient. How to take history? You must note some of the key things you must take note of if you are attempting to take history. One of them is that the most important person in the room in which you are taking that history is the patient. The patient is the most important person in the room. Okay? Therefore, allow the patient to talk. Okay? And always listen to the patient. Always listen to the patient whilst they talk. They might be telling you the diagnosis. And this quote, I took it from Sir William Osler. And if you have been in clinical medicine for long, you know who Sir William Osler is. He's a veteran, right? And actually, it is true. If you listen carefully to the patient, by the time they finish their story, you already have an idea or know what is wrong with them. Also take note that history taking is about symptoms only. There are a lot of students that confuse signs and symptoms. Symptoms are what the patient is experiencing. The lived experience of the patient is what we call symptoms. And symptoms is what the patient tells you is happening to him or her. That's a symptom. So what the patient tells you is a symptom. And that is what history taking is about. Signs are not elicited during history. It's elicited on physical examination. So sometimes when you are listening to students present history, they tend to confuse signs and symptoms. I agree that some symptoms may equally be a sign. I mean, like jaundice. The patient will come and say, hey, my eyes are yellow. Okay, yellowing of the eye is a symptom. Or if the patient is a native speaker of English, they'll tell you, I have jaundice. Jaundice is a symptom because the patient is telling you, I can see it. And when I stand in front of the mirror, I saw it. And also in physical examination, you can see jaundice as a sign. So jaundice can be a symptom, it can be a sign. But the point I'm making is that make sure you don't confuse a sign with a symptom when you are taking history, because history is purely about symptoms, right? Don't miss both, right? The signs are elicited on physical examination, like I indicated. Before taking history from the patient, first of all, you must ensure that you have the right environment. So the environment must be conducive. It must provide some privacy, even though I don't recommend that you take history in a closet with the patient alone, because there should always be a chaperone. But I recommend that the environment where you are taking the history is neat, is well aerated. I mean, the temperature in the room should be well controlled. I'm sure some Ghanaian folks who will be watching this video will be smiling, because I understand some of the consulting rooms we work in is really not up to standard. But you must ensure at least that the environment where you are seated is neat, you know, and then you have your chaperone, your lighting, and all that is good. Then the next thing is that you must introduce yourself to the patient. Mention your name to the patient and introduce your role in that clinic to the patient. I give you an example. My name is Fred. I am a doctor. I will be your doctor for today. I have mentioned my name and I've introduced my role. Okay, maybe my name is Fred. I am a surgical specialist and I'll be the one attending to you today. Let the patient know exactly who you are and the role you are playing, right? That is introduction. And then go further to establish rapport, right? Establishing rapport with the patient involves winning the trust of the patient so that the patient will feel free to tell you exactly what is wrong with them. Look, some female patients come with problems in their, in the genitourinary system, and depending on how you receive them, they may tell you about it or tell you something different. They come with obvious vaginal discharges, but they cannot mention it to you because you have not created enough rapport, you know. And they may tell you, for instance, I have a headache, and you'll be chasing a headache. Meanwhile, the problem is somewhere, you know. So it's really, really important for you to establish rapport, let your patient be relaxed, and then win the trust of the patient before you start conversation on what is wrong with the patient, right? Then also ask permission from the patient before you start your history. Look, every procedure in medicine, before you start, you must seek consent from the patient. So for instance, you tell the patient, my name is Fred, I'm a doctor and I'll be the one attending you today. I would like to ask you some few questions, right, about your illness. Do I have your permission to continue? Very simple. Once the patient said yes, you have already sought permission, you have given some information and you sought permission, and that is enough. Try as much as possible to take permission from the patient before you start your history taking. And additionally, let me emphasize on this point. You must be really polite and courteous at all times to the patients. Okay, extend the patient with all courtesies, irrespective of the race, irrespective of the socio-economic status of that patient, irrespective of the religious or political affiliation or the sex or gender of that patient. You must be polite to all persons and treat them with courtesy. It's really, really important that you treat them as human beings, right? So, in conclusion, these are some of the assets that you need to take history. One, you must really be attentive. Like I said earlier, listen to the patient and pay attention. It is offensive for you to be by the computer typing and asking the patient and not paying attention. It is offensive for you to be on your phone pressing. It doesn't matter what you are doing, okay? It's offensive for you to do that whilst you take a history. Of course, you can do that if it's urgent, but you have to inform the patient and seek their permission sort of before you do it. It's not as though the patient is more important than you, but it's important that you let them know exactly what you're doing so that they don't misinterpret what you are doing to be like ignoring them. It's also important that I must mention this as well, that when the patient comes to you in the consulting room, of course you offer them a seat. Okay, some patient finds a seat and sit down, but it's important that you tell them to sit down and pay attention, have eye-to-eye contact and all that. The next asset you need is that you must be really articulate. Okay, I said that if you are someone who does not like talking, perhaps medicine will be quite a very difficult thing for you, because medicine involves a lot of communication, talking, okay? So you have to be really articulate and you must be empathetic. We say that doctors are supposed to be empathetic, show empathy, not sympathetic, okay? You shouldn't show sympathy per se, but you must be empathetic, right? Be friendly to the patient, but you must be businesslike. So you can crack some jokes with the patient, but you must know your limit, okay? You must be business-minded, okay, in the process of taking history. You must be interested in the patient's story, and you must have a structure in mind that you are following. I'm going to take you through this structure. The structure is what forms the history taking. In the next video, we are going to go step by step through this structure. But if you are taking a history, there should always be a structure in mind that you follow. And please don't be judgmental. For instance, you ask the patient, do you drink alcohol? You say yes. Okay. How much alcohol? And the patient said, okay, I take 12 bottles of, I don't want to mention enough, maybe a local gin. And then you shout, hey, and you make it appear as if the patient is wrong, then you are really being judgmental. What it means is that your next question, the patient will massage the answer and give you something that will not excite you. For instance, if you are taking sexual history and you ask the patient how many sexual partners does the patient have, and you said, I have 12. And then you shout, and make it appear as, no, it's not good. How can one person have 12 girlfriends or boyfriends? It's not good. What are you doing to yourself? No, it's not done like, which church do you go to? Once you begin to do that, it means that you are being judgmental. Remember always that you are not a judge, you are not a moralist. If you sit on the chair of a doctor, you are a doctor and you must play that role. Even if you are a pastor and you are playing the role of a doctor, you are not supposed to pastor the patient. Please, let's get the difference right. In the hospital, you perform your role as a doctor, and then when you get outside the hospital, then you can play other roles. You are not a moralist. You are not supposed to give moral advice. You are not supposed to be judgmental. These are really, really important if you want to be a good history taker. The general structure of order or history taking that is acceptable across all levels in Ghana is as follows. You must take history on demography of the patient. You must take history on presenting complaints, history of presenting complaint. Then on direct questioning, you must review system, past medical and surgical history, drug history, family history, social history. These are the order that you must keep in mind. I'm going to go through this one by one. This is just an introductory video, so I'm not going to go through the details for now. But generally, if you are taking, if you are considering how the structure of history taking should be for Ghana, this is the order. This is general. Remember, this general structure works for general medicine, medicine, internal medicine, and surgery. For pediatrics and ONG, there is a variation that or a modification of this general structure that we'll talk about in a separate video. But for now, this is the general order of taking history in Ghana. At the end of your history taking, you are supposed to be able to summarize or synthesize the important component of your history, summarize it, and communicate to either your colleagues or to your superiors. Okay? And this is the communication aspect of history taking. It's important that you know that you are not just going to take the history and keep quiet on it, but you are taking a history so you can also communicate it. And your ability to summarize or take the relevant information from the information you just gathered and present it to another person is also a skill that you must develop as a doctor. Okay, so that's really important. Communicating your finding is so important that also in an examination you are tested for communication. So I indicated history taking is so important that in every exam there is history taking station. Communication is also really important that in every exam you are also asked to communicate your findings. So right from the outset, when you are learning how to take history, you must do that hand in hand with communication. Don't take communication for granted, because in an exam, if you can take an excellent history but you cannot synthesize and summarize your history, you may not get a full mark, and that can be a clinical failure. Okay, so it's really important. In conclusion, this is just the introduction component. Remember that for a doctor to arrive at diagnosis and treat a patient, there is a 4-step approach. The first approach is that the doctor must make or take a detailed history from the patient. After the detailed history is taken, the doctor must continue to do a thorough physical examination of that patient. Then proceed to conduct an appropriate investigation, and then once these 3 is done, the diagnosis is certain and the doctor treats the patient. This is the 4 steps approach, right? But I said out of these 4, of course, we can take the treatment out. For the doctor to arrive at a diagnosis, the most important tool is the history taking, because 70 to 80% of times, right after taking a detailed history, the doctor already knows what is wrong with you. So if the doctor doesn't send you to the lab or doesn't send you to the imaging unit to do a specific image, do not be dismayed. Don't think that the doctor doesn't know what he or she is about. It could be that at the end of that interaction with you, the doctor already has figured out what is wrong with you. Also, if the doctor has really figured out what is wrong with you, then they will only request investigation that is really necessary to either confirm or refute that diagnosis. And in the process, the doctor can save you and the healthcare system altogether a lot of cost, right? You can be saved that cost as well, and also precious time and doing unnecessary procedures and all that perhaps will not add anything relevant to the diagnosis. So please take note of this. I will see you in the main history taking video. I'm going to take my time and digest each topic one by one, so that if you have time and watch the history taking video, you should have no doubt as to how history taking is supposed to be done in Ghana. And of course, if you have any doubt at the end of that video, then you can send us a message, and then we'll see how we can help you. Thank you so much for staying with us to the end of the presentation. I will encourage you to subscribe to our channels for our subsequent videos.